Hello, East Brunswick. Before I get started on this COVID update that I have for today, November 16th of 2020, I would like to first start by thanking all the residents of East Brunswick who voted in this past election. I appreciate the support that everyone's provided for me. I look forward to the next 4 years as your mayor. And I want to make sure that everybody understands that I'm the mayor as much for those people that didn't vote for me as much as those that did. We have so much on the agenda, so many things that we're confronted with today right now, especially this COVID outbreak, which has not ended. And I do appreciate the support. But on the COVID front, a couple of things that I wanted to report to you. First of all, I'm going to show a series of slides depicting case rates going on both in New Jersey and in East Brunswick that's as current as we could possibly get it. The first slide you may see is a case rate here in New Jersey. And if you look at what's going on around us, if you look at the graph, if you read what's going on in the news, it's clear that the number of cases in New Jersey has risen. And if you look at the complete right side of the curve, you could see that we are already on track to have case rates that are very similar to what we saw this past spring. And unfortunately, I don't know where that graph is going to go. I don't know if it's going to go up from here or down from here or flatten out. But unfortunately, all indications of what's going on around the country and what's going on in New Jersey is that we're expecting that that most likely will continue to go up. But on the home front, if you look at our case rate here in East Brunswick, you will see that, yes, we also have mirrored what's going on in the state, and we are seeing an increase in the number of cases here in East Brunswick. However, our peak at this point is nowhere near the peak of what we saw this past spring. Our numbers more mimic what we saw to the second and third weeks in May when we were actually coming off of our peak. Now, again, I can't predict the future. I think that clearly the graph shows that we're on the uptick, but we are not nearly at the levels that we saw this past spring, and I'm certainly going to try to do everything in my power to do what we can so that we don't get there. On the third slide, you'll actually see our cases broken up by age groups. And they're color-coded for the months of August, September, October, and November. Now, keep in mind the November numbers are only half a month, so we could most likely be reasonable in expecting that the final number would be double than what you see on the screen. And clearly we could see in each one of those months our numbers have been going up. But what I wanted to point out is the first age group is less than and equal to age 18, which basically encompasses all of our public school children. And if you look at the curves and the numbers for August, September, October, and November, you'll see that they really aren't that much different than almost any other age group. And so what I wanted to use that as an example, I know you've been getting messages regularly as we've kept our schools open from September. And we're the only school district in all of Middlesex County to do so. And I know that you're getting regular updates from Dr. Valesky on what's going on in the schools in terms of people who've been identified with coronavirus and contacts. But I don't want you to get dissuaded by the information. Most of what you're hearing from the schools are about contacts, not necessarily individuals with infections. Because if you look at our actual numbers, the numbers of people infected in that age group are really no different than almost any other age group. And so I want people to be aware that we've been following all of the protocols. The Board of Education and the school systems have been very diligent in making sure that our hybrid program followed all the CDC and New Jersey Department of Health guidelines for managing schools. And so our numbers creeping up have not been because of anything that's been done in the schools. In fact, the most recent uptick has been noted after people were away on vacation during the week of elections. They came back and unfortunately we saw an increase not only in the schools, but in our own community through all age groups as well. And that just goes to understanding that people are getting a little COVID fatigue and not necessarily following guidelines. Some of the kids that were identified were able to indicate that many of them had actually gone away on vacations during the break. Some of our staff members had gone away on vacations during the break and came back to school when we know full well that they've visited places that were on the COVID list. So it's no surprise that our numbers went up. Our numbers are going up not because of anything in the schools, but because of our own behaviors, which we need to try to take and be in far better control of. Also want people to be aware of disinformation. Clearly that's going on with elected officials. It's going on social media, where we have individuals that and groups that are reporting information that's just factually not correct. Today alone, the Patch reported that there were 16 identified coronavirus cases in the East Brunswick public schools, which was factually incorrect. If you actually scrolled down and actually read the article, you would have seen that it was only 7 actual cases of coronavirus. The other 9 were contacts. And of the 7 identified cases, 4 were staff members, which I cannot tell you whether or not they live or do not live in East Brunswick. Only 3 were actually students from the schools. So we need to be better prepared to understand and be critical of the information that's being provided to us. But I get it. We are dealing with a little bit of COVID fatigue months and months into this pandemic, and we still need to be extraordinarily careful of our behavior and make sure that we don't do anything that would spread infection. But the good news is that the cases are not really coming out of a lot of the businesses that were opened. Most of those are behaving in a very responsible way. Our restaurants, our businesses, our personal grooming types of businesses, and our schools, as you could see from the data, are following the guidelines. Most of the reason for this increase is due to social gatherings, whether that's in your homes or going to other states and coming back and not quarantining as would be required, not practicing social distancing, not wearing face masks. These are all proven ways of mitigating against the disease. If we don't follow them, we can't be surprised if cases start to go up. I mean, and I have to say that as we approach this upcoming Thanksgiving holiday. You know, I lost my mother back in February, unrelated to COVID. And there's nothing more that I would want to do this coming November for Thanksgiving than to have all my family with me for the holiday. That's what we've done for years. My 85-year-old father, it was a hard phone call to make to him to tell him that I would rather him stay home for Thanksgiving when it's the first holiday like Thanksgiving that he's going to have without her. But we need to do that. We all need to do that. We need to make some hard decisions, but those that are going to be the most responsible decisions are going to be the ways in which we keep this infection under control. So I'm asking and I'm pleading with the public to make those same kind of decisions. I know you want to have your elderly parents with you. I know you want your kids who may be away at college. We need to be extraordinarily careful about who we bring in to the home during this holiday, because that is the way that we're finding most of the cases, and the numbers going up are from those indoor gatherings. I know that many of you may be aware of the recent executive order given by the governor, Executive Order 195, which actually allows me as mayor to limit the operations of business from 5 a.m. to 8 p.m. For beverage and food establishments, for non-essential businesses, for personal care, recreational and entertainment businesses. But as I just said before, I don't see a reason when most of these businesses are working and operating in responsible ways of limiting their hours beyond what is already the restrictions and the controls given by the governor. Now that, of course, could change. If case rates go up, if the governor changes his executive orders, if we're finding that people aren't really following the guidelines, that's subject to change. And so businesses need to know that the ultimate responsibility for enforcing all of the guidelines rests with the county prosecutor. So if we do get any complaints that come to the township or to our police department regarding those establishments, it's our obligation to provide that information to the county prosecutor, and it's her determination on whether or not the county or our own East Brunswick Police Department should intervene based on the findings. That could mean anything from a warning to a fine to potentially closing the business. That isn't our intention. We really just want people to follow the guidelines and act responsibly. So that's our plan with businesses. As far as the township's concerned, I know I mentioned earlier that we were going to open up our municipal building, but given the number of cases and the rate at which they're rising, we're going to have to go back on that. And it is my responsibility to make sure that I not only take care of this and ensure the safety of everybody living here in town, but I have an obligation to do that to our employees as well. And because of that, we're going to have to cut back on our idea of opening up the municipal building and make sure that anybody that does need and have any business with the township can do so by calling any department directly or contacting them online. If there is the need to meet with anybody, we could try to do that by appointment only, but do keep in mind that while our case rates continue to rise, we are going to do everything possible to keep that building closed and to continue the process we've been doing since March, and that is to conduct the business as we have, both by phone and through email and Zoom meetings. Our public library will remain open with its restricted hours and its limited capacity. They are following all the guidelines that are put out by the CDC and the Department of Health through the governor's office. If that has to change, we will make that noticed to everybody through social media and whatever media outlets we have available to us. I do want people also to keep in touch with both online and through whatever means possible, our library, our Parks and Rec department, and our senior center, because they have quite a innovative breadth and scope of online programs, which they've been providing throughout the lockdown. They've been doing it even when we slowly came out, and we will continue to do going forward. Also have no intention of changing the policy regarding our municipal parks. They will all remain open. They were open during the lockdown. We just want to make sure that everybody's following all of our guidelines, which are by this point should be well known. Clearly believe that it's in everybody's mental and physical health and wellness that they stay active during this pandemic and go out and bike and jog and use the parks. And our intention is not to close them unless we find that there's widespread abuse of the guidelines. I'm hopeful. Just heard today that Moderna has announced that it has a vaccine that's over 94% effective. Last week we heard that Pfizer had their vaccine, which was over 90% effective. So I am hopeful that we are hopefully at the end or close to the end of this pandemic. We just have to, stay the course a little bit longer. When and if a vaccine does become available, we will be working with our state and county representatives to make sure that we follow any type of distribution plan and try to make that available to our residents as quickly and efficiently as possible. We also, until that point, we have to learn from our history. The Spanish flu was over 100 years ago. They didn't have the advances in science that we have today. There was no treatment. There certainly was no vaccine. Science just wasn't there yet. But what they did have and worked back then is what we have today, which is social distancing, hand washing, limiting gatherings, and the use of masks. We simply need to keep doing what worked before. They did eventually get past it, and we will too. And with the advent of science, hopefully that's right around the corner. I'd like everybody to stay tuned for our upcoming Interfaith Thanksgiving program. It's sponsored every year by the Interfaith Clergy Council. That will be on Tuesday, November 24th. And until then, I'd like everybody to stay safe and have a happy and healthy Thanksgiving.